Hello, my name is Nicole. I'll be the nurse practitioner taking care of you today. We'll be doing your cardiac, respiratory, GI, GU, reflexes, and exam today. Do you have any questions?
No.
Very good. Wash my hands. First thing we're going to do is we're just going to start with the general inspection. So we're looking at the skin to look at temperature, texture, turgor, as well as looking for things like nevi, scars, mold, abrasions, trauma that we should note. So you don't see anything there. So we're also going to check anteriorly and posteriorly. We're looking for chest expansion. We're also looking to make sure that it is symmetrical. With inspiration, we're checking to see if there's any accessory muscles being used, any retractions, and I don't see any. Next, we're going to go ahead and palpate. When we're palpating, we're checking for tenderness. So doing the anterior aspect as well as posterior aspect for tenderness, and don't feel any there. The next thing we're going to do is we are going to we're going to percuss. I'm so sorry. We're going to start anteriorly. We're just going to percuss the chest. Okay, we're also going to go posteriorly and percuss. We're also going to go just a little laterally as well. And that sounds fine. We're then going to move and we are going to auscultate. So we're going to be looking for normal breath sounds. We're going to be checking if there's any diminished breath sounds. We're also going to be checking for any advantageous breath sounds. Okay, so we're going to start on the front and then we're going to go to the back. Deep breath when my stethoscope touches you. Now we're going to go posteriorly. Deep breath. Okay, very good. After auscultating, we're going to go ahead and just look at the precordium. This is the area around the heart. We're checking that area for all of the same things. So skin texture, moisture, turgor, any rashes, nevi, scars, lumps, bumps that shouldn't be there. Everything looks fine. So we're just going to palpate around the area. Are you having any tenderness?
No.
Okay, very good. Now we're going to go ahead and listen. We're going to start with listening with her sitting up. Oftentimes you can better hear a murmur with the patient sitting up, so we'll start sitting up. We're going to check with the diaphragm. We're checking on the right second intercostal space first, and this is going to be the aorta, or the aortic arch, and then we're going to come over to the pulmonic arch. And that's the second intercostal space. Now we're moving to the third intercostal space, the fourth intercostal space. And between the third and the fourth is going to be Erb's point. We're also going to check the fifth intercostal space. And then the fifth intercostal space, midclavicular, and that's going to be the apex and the point of maximum impulse. Okay, and that looks good. We're going to go do the same things with the bell. Okay, now we're going to go ahead and have you lay down, and I'm going to check those same areas with you laying down. So right second intercostal space, left second second intercostal space, third intercostal space, fourth, fifth, and then fifth midclavicular. We're also going to do with the bell laying down. Very good. While you're laying down, I am going to be looking at the jugular area. We're checking your carotid, and we're looking to see if there's any bounding, pulsations, any distension, and we're checking both the right and left side, and I don't see any. So now we're going to go ahead and palpate the area, and we're checking to see if we feel any thrills. Not on that side, not on that side. Now we're going to go ahead and auscultate, and we're checking to see if we hear any bruits. So checking with the diaphragm. Now we're going to check with the bell. Okay, great. Now we're going to move on to the abdomen. Ma'am, do you mind lifting your shirt for me, please? Okay, so we're just going to do a general inspection. Again, we're checking the temperature, the color. We're looking for moisture, any bruises, any nevi, any scarring, and everything looks good. We're also checking to see if we see any peristalsis, any herniations, any abnormal movements in the abdomen, which we do not see. So the next step is going to be, I'm going to auscultate all 4 quadrants. Okay, and I'm also going to auscultate the aorta, the iliac arteries, femoral arteries, I'm going to go back and check the arteries with the bell. Okay, now I'm going to go ahead and just palpate where the aorta is. I'm checking for any pulsations, any protrusions. Nothing there. I'm going to check the femoral arteries. I'm checking for pulse. I'm also checking for any lymph nodes. Okay, nothing felt there. I'm now going to go ahead and move on to percuss. So I'm just going to percuss all 4 quadrants. Okay, now I'm going to check the liver, which is going to be on the right-hand side. So we're going to see if we can outline the liver with percussion. Go ahead and take a deep breath. Okay, thank you. And we're going to go ahead and do the spleen as well. And if you go to the 10th intercostal space and percuss, you should hear the resonance, and then go ahead and take a deep breath and hold it in. We're percussing again, and we hear it again. So we're checking to make sure there's no abnormalities to the spleen. And so that looks okay. While we're here, we're also going to palpate. So I'm going to palpate all 4 quadrants. Okay. And I'm going to palpate a little deeper, and I want to feel the top of the liver. Take a deep breath again. Okay. We're feeling the top of the liver and the spleen as well. Take a deep breath. Okay. Now we're going to palpate the right lower quadrant. We're feeling for any tenderness to suggest maybe an appendicitis. Don't feel anything there. We're going to be checking for rebound tenderness. Any pain?
No.
Okay, we're also going to be checking for the Murphy sign, which is palpating just above the right upper quadrant, right in the area of the liver. Again, take a deep breath. Any pain with the deep breath?
No.
Okay, so if she was not able to fully do a full inspiration during that, it might suggest an issue with the gallbladder. Okay, so the other thing I'm going to have you do is I'm just going to check CVA tenderness. So if you can roll on your left side for me. So I am going to come right above, like where the kidneys are. Any pain?
No.
Okay, we're going to go to the other side and do the same thing. Any pain?
No.
Okay, you can come back. Okay, the next thing we're going to do is I'm going to do a GU check. Since you are of good age, we would normally do a breast exam as well as a pap smear and a pelvic exam. But for the purpose of this exam, we are going to bypass that. So we're going to move on and we are going to have you sit up. I'm going to do your reflexes. So I'm going to use a pen for the purpose of the reflexes. So just relax. We're going to do your brachial radius reflex. Okay, very good. Now we're going to come and do the bicep reflex. Very good. And triceps. We're going to just let you relax. All right, very good. And we're going to do the same thing on the opposite side. Very good. Very good. And then just relax. Very good. Okay, we're going to come down and we're going to do the patellar reflexes. Very good. Very good. We're also going to do the tendon reflex. Very good. Very good. Okay, and the other thing we're going to do, if you can scoot back, I'm just going to do something called the Babinski reflex. This should not be positive in an adult. It would be normal in an infant. So I'm going to take my pen from the heel and go up to the toe, and that's a normal reflex. Very good. That's a normal reflex. So we don't want her toes to be splayed apart. That would be normal for an infant, but it would suggest a neurological problem in an adult. Very good. Now I'm just going to check your sensation. You can come forward, close your eyes for me. Okay, please tell me if you feel just something soft or something sharp, okay?
Soft. Hard. Soft. Hard. Hard. Soft. Hard. 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 Soft.
Okay, very good. I'm also going to be checking if you have any kind of a pronator drift. Go ahead and keep your eyes closed. I want you to hold your hands out like you're holding a tray. Okay, and we're just checking to see if there's any drift while her eyes are closed. And I don't see anything, you can go ahead and open your eyes. I'm also going to be checking just to make sure you can follow me. So I want you to take your finger and touch my pen and your nose. Pen, nose, pen, nose. Very good. While we're here, we're going to check your gait. So go ahead and stand for me. I'm going to have you come right over here. I'm going to have you just place one foot in your heel in front of your toes. Very good. Heel in front of your toes. Very good. Heel in front of your toes. Very good. You can come back and have a seat. And the last thing we're going to do are going to be your cranial nerves. So we're going to start with cranial nerve 1, which is olfactory. I have an alcohol swab. Go ahead and cover your left nostril. Okay, tell me, can you smell this?
Yes.
Okay, go ahead and cover your right nostril. Can you smell this?
Yes.
Very good. We're also going to be checking cranial nerves 2, 3, and 4. And these are going to be the ocular cranial nerves. So this is a pen light. So go ahead and just look straight ahead at me. I'm looking at the pupils to make sure they're leaving constriction, to make sure they're reactive to light. I'm also going to have you follow my pen for me. Very good. And I'm going to check for convergence. Okay, that's good as well. We're going to check your trigeminal nerve, which is cranial nerve. Go ahead and clench your jaw. Very good. Move your jaw from side to side. Very good. Okay, we're going to check your facial nerve, which is cranial nerve 7. Go ahead and raise your eyebrows. Okay, smile, show me your teeth. Puff out your cheeks. Very good. I'm going to check cranial nerves 9, 11, and 12. So go ahead and open your mouth for me. Stick out your tongue. Move it to the left. Move it to the right. Touch the top of your, very good. And I'm going to have you lean forward. I'm going to look at your hard and soft palate. Open up. Okay. All of that looks good. And the last thing I'm going to do is I'm going to check your spinal nerve, and that is 11. Go ahead and shrug your shoulders. Very good. Relax. Go ahead and push to your left. Very good. Push to your right. Very good. And that concludes our exam.